All right, we are doing the cervical phase 2 rehabilitation in this video. Again, just like all the other ones, if you have issues with any of them, please bring them to our attention. I do not want you to be in pain while we're performing this, okay? The first one, which is very similar to a Brugger's exercise that is in our spinal mobility program, is gonna be bilateral scapular retractions, and I'm gonna add a little breathing into it, because breathing is always super important. Arms start in front of us like this. We are gonna let the elbows come back behind our rib cage with this one. Open up the front of the chest here. And again, I'm going to breathe massively into the front of my rib cage through here, and I'm gonna hold that. You can do it in a couple different ways where you could do 10 reps with a breath each time and 3 sets of that, which is totally fine. Or the way that I like to do it, I like to hold these positions for a little longer. So I might hold this for 2 or 3 breaths and just do that 3 or 4 times. It's all the same idea. Don't get super caught up on the rep times, all these kinds of things. Just make sure you move and we'll be winning. All right, the next one, we are gonna be going all the way down, and I'll spin this way to make it easier for you. This is our floor angels. Just pretend like you're in the snow again. Do it knees bent, not bent. If you have low back pain, you're probably gonna want your knees bent, most likely. As you do this, you'll notice that if you have a super tight chest, your hands are gonna not even wanna go down. So you might have to force them down if that's the case. If your shoulders hurt in this position, don't force it. Do what you can, please, okay? We can always modify it. If you have issues, let us know. But all I'm gonna do is I'm gonna be pushing my arms up and together without my arms coming off the ground in a perfect world. I'm gonna come down. Good, back to neutral, and all the way up. The purpose of this is that most of our shoulders round really far forward, so we can't even get them back up, and use the muscles on the posterior aspect around the back side of our shoulders and back to actually pull us that other direction and not let us get stuck forward. So that's the whole purpose of this. If your shoulders are crackling, you're getting popping, don't worry about that. As long as it's not painful, I want you to keep doing it. Okay? The next one is deep neck flexor strengthening, and all that is the front side of the neck muscles trying to engage them. Most of us in our world, we have really tight muscles in the back side of our necks, so we always try and stretch them, when those are also trying to be strengthened and these are also trying to be strengthened. So all you're going to do is lift your head up. This is not a maximum range of motion exercise. It is a lift and hover. We're gonna hold this for only about 10 seconds, and we're gonna do 3 sets of that. I want you to take a break for maybe 20 or 30 seconds in between. But you'll notice that we don't use these muscles like this very often. The first few times I did this, the next day you're gonna wake up, you're probably gonna be sore. If that's the case, go backwards a little bit. Do not keep pushing yourself as intensely. If you have any questions, just let us know. All right. The next one we're gonna be performing is the thread the needle. All that is we're gonna be on our hands and knees. I'm gonna bring my arm all the way through, and it's gonna feel like a nice stretch on the back side of my opposite shoulder and in my lat, and maybe even my low back a little bit. But what we're gonna create is a lot of rotation at the thoracic spine, which is what its primary motion is. And then we're gonna breathe and open up space. I'll hold that for a second or two. I'm gonna come back the other direction. And again, I'm getting that stretch on that back left side, opening, 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 stable with the arm that's on the ground. Again, we're gonna perform that each side about 10 times, just going back and forth with a nice flow, okay? The last one is our head retraction exercise. And it's gonna go hand in hand with the deep flexor exercise, where all we're gonna be doing is bringing when I was taught it in school, you put your finger on your chin, and you just go away from it. Relax, hold it for a moment, relax. Same thing back. You don't need the finger on your chin if you don't want to, it's not as fun. Just pulling straight back. But the big thing about it, and why we like the finger on the chin, is it's not extension. It's not this. It is straight away, straight backwards. So you're gonna feel like you get some tightening in the lower neck, or the front side of your neck, and that's exactly what we want to get. Okay? Please give those a try. If you have questions, let us know.